Hello everyone, in this video we'll be discussing about the Tweed's analysis. Dr. Charles H. Tweed gave the diagnostic facial triangle that involves three planes basically. The one is the tangent to the mandible known as the mandibular plane, then Frankfurt horizontal plane and the mandibular incisors axis. Okay, so these were the three planes which were discussed and which formed a triangle, and that's why it is known as the facial diagnostic triangle also. So Tweed developed the Tweed's analysis in year 1946, and the Tweed analysis makes use of three planes that form a diagnostic triangle, right? So this is important, and the planes used are Frankfurt horizontal plane, mandibular plane and long axis of the lower incisors. So basically it was an attempt by Tweed to give the deflection of the mandible in relation to the Frankfurt horizontal plane, at the same time considering the long axis of the mandibular incisor also. Now the objective of the Tweed's analysis is just to give an evaluation to the prognostic factors or prognosis of the case, right? So the determination of the position of the lower incisor is one of the objective, and then giving the evaluation of the treatment prognosis of a case, right? Now there are three planes which we have just discussed. The first one is the Frankfurt horizontal plane. Now what is this? This is a plane that is formed by joining 2 points. One point is at the lowest margin of the orbital, and another point is at the highest point of the external auditory meter. So if you join these 2 points and draw a plane, that is known as the Frankfurt horizontal plane. At the same time, if you want to know about the mandibular plane, you have to just draw a tangent to the mandible in case of Tweed's analysis. Now this mandibular plane angle plane generally differs in different analysis. For Tweed's, we can remember T for tangent and T for Tweed's. So in Tweed's, you'll get mandibular plane by passing a tangent through the mandible. Then the third plane which we get is the mandibular incisor plane. So that will be obtained by passing it through the long axis of the mandibular incisor. So these three planes will be intersecting each other at certain angles, and will have those angles by these names. For example, here Frankfurt horizontal plane is there and mandibular plane is there. So we can say that it is the Frankfurt and mandibular plane angle, right? Same way, this angle is formed by Frankfurt horizontal plane and the mandibular incisor. So we can call it as Frankfurt mandibular incisor angle. This angle is formed by mandibular incisors as well as mandibular plane. So it is known as the incisor mandibular plane angle. So these are the different names. So we have certain values for these also. We'll be discussing those. First, the Frankfurt mandibular plane angle, we got it. The incisor mandibular plane angle, this one is the incisor mandibular plane angle, and then Frankfurt mandibular incisor angle. So this one is the Frankfurt mandibular incisor angle. So which one is Frankfurt mandibular plane angle? This one is the Frankfurt mandibular plane angle. I hope this is clear. So the values of different angles here, the Frankfurt mandibular plane angle, the mean value is 25 degree and the range is around 20 to 30 degree. Incisor mandibular plane angle will be having the mean value as 90 degree and the range will be 85 to 95 degree. And Frankfurt mandibular incisor angle will be, like, you can get it by subtracting these sum from 180, right? So 180 minus 115, you'll get it around 65, right? So these are the mean values. The range will be 60 to 75 degree. Again, seeing here, if we try to understand the Frankfurt mandibular plane angle, so which one is this? This is Frankfurt mandibular plane angle. This is the smallest one, 25 degree. This one, IMPA, should be around 90 degree. And then we'll have the Frankfurt mandibular incisor angle that could be around 65 degree. Now there are three Tweed's growth trend, type A, type B and type C. Let's see what are these. Type A is generally seen in 25% of the population, and it is in type A you'll get the middle and lower third of the will be growing in the downward as well as forward direction simultaneously, right? So growth is of course equal in vertical and the horizontal plane, and the A and B angle is generally unchanged and it is near 4.5 degree. Okay, so it is near 4.5 degree or less than 4.5 degree. If it is more than 4.5 degree, it is known as type A subdivision. Okay. So for these conditions, these are perfect conditions, they do not require any treatment, and in this you will be seeing the class 1 molar relationship only. Now we have the type B. It is generally seen in 15% of the population, and in this the middle face grows rapidly, right? And it grows much rapidly than the lower face, and in this particular case A and B is increased. So generally what happens, if A and B is less than 4 degree, then we have fair prognosis, but if it is 6 to 12 degree, then the prognosis becomes very poor, right? So type B, 15% are seen. Middle face will be growing forward rapidly than the lower face. A and B angle is increased. If A and B is less than 4 degree, then the prognosis will be fair, and if it is 6 to 12 degree, then it will be poor. Then we have the type C, which is seen in the maximum cases, that is 60% of the cases, in which the lower face grows forward and downward more rapidly than the middle face. So in this you will be seeing the decreased A and B angle, right? Now this type C subdivision, so there is a subdivision also for the type C. In this particular, the growth vertically confined to the horizontal direction with little vertical growth. So it has the excellent prognosis. So the whole growth is generally confined in the horizontal direction where the little vertical growth takes place, and that's why it is having good prognosis, or the excellent prognosis, I can say, out of all the three, right? Now certain frequently asked questions on Tweed's analysis. Basically they'll be asking you the angles and the deviation of the angles, and then you can relate to the vertical growth or the horizontal growth pattern, all that, right? So here Frankfurt mandibular plane angle, the mean value is 25 degree and range is 20 to 30 degree, while the incisor mandibular plane angle, the mean value is 90 degree or range can be 85 to 95 degree. Then we have the Frankfurt mandibular incisal angle. So here the mean value is 65 degree and the range can be 60 to 75 degree.